Hi, my name is Jonathan Kutscher. I'm a paramedic who works in the Ridge Coast area for Liberty Ambulance. We also service Lake Isabella, Currantville, Cal City, and Yokern. I'm here today to tell you a little bit about sepsis. September is Sepsis Awareness Month, and I wanted to inform you guys how to maybe identify sepsis and what might be some of the causing factors for it, or risk factors that would make you more likely to get it. So what is sepsis? Sepsis is the body's response to an infection, but it is a global response. The whole body starts having a lot more issues. Generally, the infection is becoming more spread out throughout the body. This can cause damage to your tissues, organs, and possibly a loss of life. Let's go over what sepsis is a little bit more in depth at first. So sepsis starts with just the smallest of infections. It can be a bug bite, it could be a little scab that gets infected, and then it grows more and more rapidly. Or it could be something more seriously known like pneumonia or meningitis. So it can be something that seems very, very minor that becomes much more major. Some risk factors deal with generally people who are younger or people who are older, under 5 and over 55 ages are people more at risk for getting sepsis, as well as people who possibly have some issues with their immune system. Some issues could be from diabetes, from cancer, from other illnesses that cause the immune system to be lowered. There are some ways to kind of remember the signs and symptoms that you might be able to identify in people you know, or you see anyone that may be showing them. The mnemonic you can use is TIME, T-I-M-E. T stands for temperature, I infection, M mental decline, and E extremely ill. So when you talk about the temperature, you're talking about, are they hotter than normal? Are they lower body temperature than normal? A normal body temperature usually is around 98.6. But with sepsis, you can have a fever or you could have a lower body temperature. I, infection. Are there any signs and symptoms of an infection? A lot of the elderly population, generally over the age of 55 or higher, can get urinary tract infections often. So looking for signs and symptoms of that, or looking for any wound that looks enraged and inflamed, could be a sign of infection. And mental decline. Generally with people with sepsis start becoming confused. They start not really knowing what's going on, not acting right, acting abnormal, not doing what they normally would or how they'd normally do it. They could also seem groggy, tired, and weak. E, extremely ill. So someone with sepsis is also going to be weak, possibly dizzy, maybe some nausea and vomiting. Just not going to feel good at all. So if they start feeling bad and they have a mental decline as well as a high temperature, there's a chance that they could be having an infection going on that's causing sepsis. Prevention. How can you stop sepsis from occurring? It really starts with stopping infections. So you're going to want to have good constant hygiene. Always wash your hands, be careful where you touch. If you know someone's sick, stay away from them. That type of a thing. You don't want to be in a situation where you're possibly going to get infected. And if you have any wounds, like little scrapes, cuts, make sure you take care of it properly, clean it thoroughly, and put on antibiotic ointment if need be. The main thing is stopping the infection rather than stopping, that's how you stop sepsis. So if you want to know more information about sepsis, then you can look it up at sepsis.org. That's sepsis.org. Also, throughout the rest of September, we're going to put out some more tidbits and information on our social media. So if you can find either Ridge Coast Regional or Liberty Ambulance on Instagram or Facebook and follow us, you'll get some wonderful notifications and posts about sepsis and how to identify it and what to do. So I hope you guys have a great day and stay safe out there.